My name is Adam Thompson. I am the facilitator for the Age Affinity group. And I joined this collaborative because I thought it was really important for us to start looking at not everybody as one giant bucket, but to really start looking at meaningful differences in our community and our outcomes and trying to really uncover what interventions were going to be most effective at supporting those who are most marginalized.
Hi, everyone. My name is Rose Connor. I am from Phoenix, Arizona. I am working with both the Ryan Part A and the Ryan Part B program on housing issues. And I am a faculty member for the CQII Learning Collaborative related to housing and homelessness.
Hi, my name is Raquel Ellison. I'm with the resource group in Houston. I'm the consumer relations coordinator, and my role pretty much is to be the, I started as the liaison between the staff and our providers and the consumers. We are part of the mental health affinity group.
So my name is MULAMBA, LUNDA, and I am in Columbia, South Carolina, which is where my work location is. And I joined the as part of the collaborative. I'm one of the faculty, and I'm on the mental health affinity group. I joined the collaborative because I'm very driven by process. I'd always infused and interested to see how things change.
A couple of months ago, I had an opportunity to attend a meeting of sort of national thought leaders around quality management, quality improvement, and in particular, quality measurement. In those conversations, I had the privilege of being a fly on the wall of hearing some of our country's greatest experts talking. And I remember Don Berwick mentioning that if we really wanted to solve our problems in healthcare, we were going to have to learn to measure two things, trust and respect. So when I think about trust, as I think about it, I ask myself that question, am I trustworthy? And I think that to answer that, you have to sort of understand what trust is. And, you know, in my understanding of it, whatever I can offer to the world, I think trust is something that is built when you make and keep commitments to other people.
I think trust, to me, really respect, kind of trying to understand another person or trying to being understood. And also meaning that, you know, the other person is taking my feelings and my experiences into consideration of as a part of the process of what you know, or the visit or whatever the situation is that we're in. From the time I walk in the front to the time that I leave, I should feel and see the general kindness and caring among the people that are serving, even around the clinics.
So trust and respect to me, when it comes to my health, is being able to be heard, being able to feel like I'm a part of some of the decisions being made, or because we're basically a team. And I think there needs to be mutual respect, as far as I respect the fact that the medical staff has trained for this and gone to school and studied these, the things that they know. But also I need them to respect that I've lived this life my entire life. So I am the expert of me. I can tell you what I will do, what I won't do, how I'm feeling about completing a task. Even when I gave feedback as to things that were happening as far as side effects, those things weren't listened to. They actually fought with me for 9 months over my blood pressure and changing the blood pressure med. And I was very confused as to why I wasn't being listened to. I'm like, it's a blood pressure med. And they were arguing with me like, well, you can't tell the doctor what to do. I said, I'm not telling the doctor what to do. I am just giving them feedback on how I'm feeling. Y'all have diagnosed me with high blood pressure. And so if it's out of control and I'm telling you the med isn't working and you're telling me the med isn't working, then why can't we just try something else? And so that was very frustrating. And it went on for 9 months. And the moment that they changed the med, my blood pressure went to normal.
So I think when looking in terms of what can quality improvement do about trust, with trust, in the space of trust, I honestly think it's little simple things. You know, for me, trust is this idea about sort of making and, you know, following up on your commitments to people. Every day, our systems don't do that. We don't call people back when we're supposed to. We don't answer the phone when we say that we will. Sometimes the service that we promise doesn't come through, or the medical visit time that we promise somebody is 30 minutes late. Those little tiny breaches of trust over and over again demonstrate, I think, to communities and to patients not to trust you.
And I've had the experience myself where I've come in for a follow-up appointment with a provider who spends the entire visit time focused on the computer, asking questions to the computer, not to the patient, myself, and then not even doing a physical exam, basically reading his information from the computer, looking at the instructions on the computer, giving me instructions from there, and walking out without even interacting with me with even eye contact. And in that case, I personally changed providers. I would not return back to that provider.
Last one I remember was just a person that was at the window where, you know, where you close the windows, at the front desk, and you close the windows, and the person really was needing to ask a question and was not attended to, really assuming that they had been there because they had been there, that they knew where to go and where the bathrooms were. So in that respect, the person ended up waiting. And so I actually did get up and speak on behalf of the person because they actually were getting frustrated. They actually needed to use the bathroom. And I just thought, you know, it's important to kind of just hear what, even if somebody has stood up maybe 3 or 4 times, you still just open the window and be able to address and see what their need is.
As a patient, you need to feel comfortable being able to update your doctor on what's going on with you or how something is affecting you.
Particularly for young people, the issue of confidentiality is so key. And there needs to be a way for providers to build trust with those young people to make sure that they are totally understanding that their confidentiality will be respected.
This collaborative gives us an opportunity to implement the steps of a process in true partnership with people with HIV. And if your organization is struggling to understand how to form that shared narrative, I think it starts with a basic shared process. And that's what I love about quality improvement. There are steps and people can do them together. For me, that's the biggest draw, I think, not only into quality, but into collaborative learning.
Just being able to admit if a mistake or mistakes are made, and not trying to, you know, cover it up or anything like that. It takes the conversation into another level, and I think much respect is gained from that, just by that admission. So I think, you know, and it's also explaining. So not just admitting to the mistake, but also explaining you know, what happened and taking the time, respecting the person enough to share with them, you know, the what, why, and how we're going to do something differently the next time so it doesn't happen again.
Very rare is it included in the satisfaction survey as to whether or not you trust your clinic and do you trust your provider with dealing with your care or dealing with your confidentiality or dealing with helping you get to the next step in your care plan. And I would agree that that might be something that could be looked at from the quality perspective.
They're trusting, you know, providers to take care of them. So with thinking about patient safety and saying, hey, if you can give us some feedback, I think to me that even says, oh, you know, they're asking for my input on how things are going. I think that that is a good way to even continue and gain even more respect with that.
I feel like there needs to be a lot more focus on the agency level for change management and understanding meaningful and purposeful involvement and engagement of consumers, and also a lot of training on experience-based co-design. Those things need to be focused on understanding that it's necessary to prepare people to be able to participate.